So we're going to get started. We've got 131 members of our MercyOne leadership team on the call thus far. So good morning to you all. And thank you for taking the time this morning to join. And most importantly, thank you for everything you're doing. We all know it's been a year plus that we've come together to tackle a situation that none of us ever anticipated. But I can tell you, looking back, I don't think we should have anything but pride about how the fact that we've done this together and that our communities have been protected and Iowans have been saved. I know we've lost over almost 6,000 Iowans in this pandemic, but I can assure you the work that you've done and all of our colleagues has protected many, many, many more Iowans. And for that, you should be very proud. I'm going to go ahead and start off the reflection, and then we'll move into a couple comments, and then I'll turn it over to other people that are going to provide some updates this morning. So with that, please join me. Father, we come to you as leaders of MercyOne with a very special purpose. We represent the mission of mercy to those in need and to our communities. Our plight is to make everyone's life the best it can possibly be. We do that through 20,000 amazing colleagues, physicians, providers, colleagues who work tirelessly in the name of our mission. And that's possible because of our leaders and the way that they inspire and guide and frankly nurture our ministry. And for that, Father, we are grateful. We ask that you bless all of our leaders, our caregivers, and all those that we're privileged to serve. And I think in light of this pandemic, bless our state and our communities. And we ask for this as we ask for all things in the name of your Son, Jesus Christ, amen. So good morning once again. Happy spring. Holy Week is right around the corner, which is a special week for our mission. And want to really and sincerely and genuinely say thank you for everything. I know that these days have been tiring. I know there's a level of pandemic fatigue. And I know that more and more Iowans are being vaccinated. I believe we're up close to 515,000 that have 2 doses of vaccine. There's rumors about another vaccine, and yet at the same time, we understand 2.5 million U.S. Individuals in the U.S. are being vaccinated every day, and that number keeps going up. So there's hope. And as we enjoy the transition from winter to spring, one that may be a little soggy, a little gray this week, we know that this is a sign of the future. And so too do we know that the pandemic is about to be in our history books. Now, let me be the first to say that we have to heed the precautions and listen to the experts about what we need to do as we tail down on this thing, because it's not over yet. But let's have some hope and some sense of accomplishment that the future is bright and that together each of you have helped make us strong throughout this crisis. And sometimes crises make teams stronger and more unified. And I can certainly tell you from my perspective, that has been the case for MercyOne. So my message to you is nothing more than thank you. I'm going to turn it over to Jackie. We're going to talk about the engagement survey this morning. Then Mike's going to talk about performance. What would a meeting be without Mike talking about performance? Then we're going to talk about our strategic plan and advocacy. We want to leave some time for conversation. So with that, Jackie, it's all you for engagement surveys.
Good morning. So we are on the heels of our engagement survey again, which is April 26th as the kickoff. And we anticipate that we will be receiving emails in the afternoon that day. So more information around that. But we're really wanting us to engage in conversations with our colleagues right now through various methods. Sometimes huddles would be a great idea, as I know many of you already are, department meetings, org huddles, that kind of thing. So today we're going to practice a poster that is this week's theme, and want you to think about what's here on the screen here, what excites you about your work at MercyOne. And as you lead these discussions, think about how you might engage your team and thinking about some examples. So I appreciate Bob's reflection on this past year. It certainly has helped us grow as one, and at the same time, we've been through a lot together. And so there's a lot of things as we learn today, again, as we update our strategy and learn from each other. So we're going to do it through chat. I'm going to try to grab some chats as I see them come through. But go ahead and put in your words or word or your thoughts. What you've heard from your team might be a good example to share about what is exciting about the work at MercyOne. 30 seconds. That's all we want to do, just to get some great support, growth, dedication, helping people in recovery, continuous improvement, innovation. You can see them populating: innovation, teamwork, service, impact to our communities, sharing expertise, mission, service, a lot of similar things, great teams, community support, daily challenge, work is always different, great colleagues, selfless caregivers, I like that one, mission and purpose, values, opportunity to support caregivers.
Jackie, while you do that, I'll model the mask.
Thank you. Yes, I don't even have one of those.
Just to make it real.
So, working with all regions across MercyOne on integration, teamwork, mission. So you can see this isn't hard. There are lots of things that we are excited about and know we have work ahead of us as we lean and learn. As I read that from Chai, I was thinking lean, but it's really learning and leaning on each other from that standpoint, being a part of something bigger. So great words, thoughts. Appreciate your engagement in this. And again, just really want you to lead this with your teams and find the energy to talk through this. And we know we also want to hear from them what we're going to do and can do better. But in the meantime, let's continue these types of conversations. A reminder that the resources are on mercy.one, and I think that slide is next, Cassie, that you can show. And Lydia and I are finalizing the survey questions. The coordinators will share them with the coordinators after we've talked through that with our executive leadership team and OMT here with the presidents, and we'll follow up with the specifics and share the questions once they are finalized from Press Gate. Thanks for your time.
Okay, thanks, Jackie. Mike Wegner, how about a performance update?
All right, Bob. Well, actually, everybody lucks out because they don't have to listen to a performance update from me. Cassie reached out to 5 different individuals to share our key result performance on a year-to-date basis because, as you know, it takes all of us to generate the results we're getting. So Cassie's reached out to someone to cover consumer experience. And I'm not sure who that is, but I know they know who they are.
Actually, Mike, it's Kay. Good morning, everybody. Can you hear me okay?
Yes.
Great. So happy to talk a little bit very briefly. It's hard to do it very concisely, I think, as everyone knows about consumer experience. There's great work happening across the state and in the Eastern Iowa region, specifically around consumer experience. I think everybody is aware that Eastern Iowa actually includes 2 distinct markets in Clinton and Dubuque. And then our result also includes our critical access hospitals in Dyersville and Elkader. We have work happening regionally. A couple quick things I would highlight. One that I think we've talked about before, but that I think is really critical success factor for us, and that is making sure that our results are available to all of our leaders. We discovered early last summer that the results weren't getting to the directors. The report that we had created wasn't being produced anymore. So went to work on that immediately. Jason Schneeberger and Jackie Brunson and others constructed a dashboard that is excellent so that all of our leaders and stakeholders know what our performance is. And then recently, actually, we are in the process of doing some work to improve our huddles. We've been huddling for a long, long time, but especially in the Dubuque market, had a lot of drift in sort of the structure, and we noted that we had a lot of variability. So had a team of our leaders come together and really refine the huddle process. And of course, consumer experience is featured in our huddles on the units. The markets also in Eastern Iowa have really pretty mature structure in place around improvement in consumer experience. So I sent Cassie a couple of quick slides just to maybe share a couple features. This is actually our consumer experience result in acute care. Overall in acute care, Eastern Iowa is actually performing at the 57th percentile, which is not quite to our baseline of the 59th percentile. The story that we wanted to share here is related to acute care in Dubuque specifically. We're almost at top decile performance in Dubuque at the 88th percentile in acute care. And you can see the trend line, which actually since March of 20 has been steadily increasing. Again, pretty mature structure, model of caring continues to be kind of embedded for us. And Bob Wethel is leading our model of caring team that incorporates all of our leaders from all of the departments, and new work that they're focusing on or that we're focusing on is around telling the patient what the medicine was for, which is a key driver. And just because we all know that consumer experience really comes down to every single patient encounter. And since we didn't do focused storytelling at the outset, I thought I'd just share kind of a glimpse of, the kind of thing that I think drives this level of performance. And I know these stories exist everywhere. I've heard them, but wanted to share this one. Yesterday, we had a very pleasant 78-year-old woman admitted for a preoperative carotid endarterectomy. The staff, Janice Krappel, Andrea Kleesner, Natalie Oltmans, prepping this woman for surgery, quickly realized she was unable to care for herself as she had some concerning hygiene and self-care issues. The woman has no shower at home, washing machine was broke, and her brother, who was her caretaker, had passed away 2 years ago. The ambulatory staff proceeded to give the woman a shower in the department, combed through her hair, which was long and matted. Multiple runs were made to 4 West for shampoo, lots of shampoo. The patient told Janice, just shave it off. Janice maintained her dignity and convinced her to trim it. She was able to cut her hair, which looked professional. She even cut some very fitting bangs. Patient's toenails were long, curled, and unkempt. Natalie proceeded to wash her feet in the shower. Andrea chose to use her morning break to run to Tyson's to purchase the woman new boots and socks, which they split the cost among each other because it was the right thing to do. It doesn't end there. They arranged for her clothes to be washed on the skilled unit so they were clean and ready for discharge. Janice arranged for case management to get involved and got podiatry scheduled to visit her to care for her feet next week. They did all of this with such tact and professionalism that ensured the patient felt comfortable and not ashamed or embarrassed. These 3 went above on so many levels. Other staff and department volunteered without hesitation to assist, running for supplies, shifting our focus to cover for patients in that pod so they can continue to care their cares with her. And other departments stepping up and offering supplies without question when we called. This is what a team does when they own it. So incredibly humbled and proud to work with this MercyOne team. So just an example of, again, this consumer experience all comes down to every single patient encounter at 2 in the morning and 2 in the afternoon. And just a nice example, I think. Cassie, you can go to the next slide. Very quickly, another quick feature. This is our ED experience, and I was going to share overall experience in Eastern Iowa. Our composite is at the 38th percentile. So we obviously have work to do. This has been impacted significantly by the addition of our medical group in Clinton, who has never really they've not experienced patient satisfaction surveys historically. We're at the 17th percentile in our clinics. And so we have a great opportunity and work ahead that we know will also impact the composite score for the region. This is our ED result, and you can see as a region, we're at the 40th percentile. Again, we have work to do here. Feature is the ED in Clinton, which is most recently at the 29th percentile in the February scorecard, compared with our max of the 48th and our min of the 17th. But the nice thing about this chart and the excellent work that's happening with our Clinton team is just the, again, slow, steady, positive trend line, especially from around June of 20. And good work there led by Melissa Bittner and Susan Davis, especially with our providers focused on the key driver of doctors' courtesy. And again, those simple actions, intentional around sitting when possible, and these 3 touch points during the encounter. So just a really quick flash of what's happening in Eastern Iowa, and we're excited to continue to improve these scores. Thanks, guys.
Thanks, Kay. Cassie, who's next? Or Mike?
Carl's next to go through engagement.
Okay, let's try let's just make sure we keep it to 2 minutes each, just so we make sure we have time for conversation.
Okay, I will keep it to 2 minutes, Bob. Thanks. So we are all excited, I'm sure, to have our survey. I know we skipped it last year and didn't get the feedback that we normally like from our colleagues. So we're excited to have it this year. As we look at this year, I think it starts with our 90 days to engagement. So I think that the work that we've done with regard to the 90 days of engagement, I think that toolkit is excellent and really helps. If everyone's following that, absolutely, I believe we'll be able to see those results. So reviewing your data again with your team, do those roundings up to 3 times between now and the survey, going to the huddles, doing, for us in Central Iowa, we do a "you said it, we did it." So the things that people talked about last time, and then we demonstrate or say, here what we've been able to do to hit those key results. We have that "you said it, we did it," not only from a department perspective at the huddles, but then we put it in our Mercy news on a weekly basis, those things that we have done that were asked from our colleagues. And from an executive team, we have gone through all of our departments, and we have now sponsored. Each one of our executives at Central Iowa are sponsoring a different number of departments, anywhere from 5 to 8 departments that we are taking that responsibility. We normally round with our departments, but these ones we are helping the leader, doing more mentoring with that leader, and helping them with their department and spending more time in those departments. And then, just doing some of the activities. This year has been a very tough year. So for Central Iowa, our first case of COVID was the 13th of last year. So the week of the 8th, we did a week where we called it Reflect, Renew, and Reboot. So we had a number of activities and things we did during that week to really help appreciate and thank all of our colleagues for this rewarding, exhausting year that we've had, and had a number of activities that we did, from cornhole to actually having these paper hands that we put on the walls where people put what they were thankful for or who they were thankful for, and delivering gifts. And even I think the gifts, as we delivered things to people, we had things for pets, so different things that people could take to reward their pets. I think that was like a huge benefit. And these things, actually, we did get one of our community churches sponsored it and gave us $70,000 that we could help with that resiliency with our employees, which was an amazing gift that we did receive. And then even just simple things, when we had that really cold weather, all of the executives went to all of our clinics and all of our departments and delivered hot chocolate and coffee. So just looking at different ways to say thank you and give appreciation during these different times. But at the end of the day, it's how are we making the changes, how are we sustaining those changes with our own departments. So I could say more, Bob, but we're excited for the survey for this year and believe our results will improve as we become one.
Fantastic.
Thank you, Carl. Next is quality, and that's our all-cause unplanned 30-day readmission rate for certain types of services. And Dr. Seika is going to provide that update.
Yes. I have to look back at when I first started with MercyOne 3 years ago. This number came up, and we were the worst at MercyOne. We were over 18% readmission rate. And we struggled with what we could do to improve. And we started doing a post-safety call huddle on every readmission, not just the ones that are on this list, not just the ones that are our MSSP, because we felt that every readmission was an opportunity to improve, to learn, to keep moving forward. And as we've gone through this journey, we've seen our number go as low as 6.6% in the region, which is 99.9th percentile. During the surges, we did bump a little bit. Our focus, even though we were working on those readmissions, there was so much work going on last April, last November. But and we were 13.5% 2 months ago. As that April's dropped off, we continue to have that call. And that call involves any nursing personnel that took care of the patient the first time, the providers, if they can get on the call or have time. And one of the recent additions is we've added a post-acute nurse practitioner, Tabitha Gerke. And even if it's not an MSSP patient, because she works with the PHSO very closely, she will get engaged with that patient, work on even trying to see them outside the hospital, trying to prevent that readmission on some of the most frail, most vulnerable individuals in our community. So this project really has brought team effort, team engagement together as we work as one, and just offering the best care for the patient. So that's what we've done here. We continue to do this every day that we have a readmission, and we continue to learn. Any questions?
All right, thanks, Matt. You guys have done an incredible job. As you mentioned, your scores were high, or our scores were high there a few years ago, and you got them down, to some of the lowest scores in the country for readmissions. So great job there. And then let's move to financial performance. Beth Hughes is going to give us an update there, and Beth and Tim and Jessica and the whole team in Western Iowa have done an amazing job on financial performance.
Thanks, Mike. Good morning, everybody. It's really, when Cassie asked Western Iowa to speak about financial performance, I have to believe that that's been the first time that we've been able to celebrate that in a long time. So, and it really, it's, as I think everybody knows, it's a village issue. And the way to get to financial performance, the way we all like to get there is through growth. There's been a lot of activity in Western Iowa around growth, but like every other market, we have experienced a reduction in our volume pretty significantly, both in discharges and surgery, our emergency room volume. So we turn our sights to other ways to improve our financial performance. And the focus really has been on revenue cycle and labor cost management. I think everybody knows that a big focus on rev cycle is a village issue. So it includes patient access, it includes HIM, clinical documentation, case management, the billing team, all of finance, our physicians, particularly our hospitalists. And their focus has been on denials. And, this team meets weekly to discuss denials and the trends in denials and what's happening. And we've been able to, through improving our front end registration process, our coding, increasing our peer-to-peers with our hospitalist group, we've been able to reduce denials by $500,000 this year, year to date. The other focus in revenue cycle has been point of service collection. And perhaps this was done better in other regions, but we found in Western Iowa, we were really lagging behind in our point of service collections. So again, I think it's a real village issue. The ED and the clinics were a focus. They really hadn't been doing point of service collections. And so for the first time ever in February, we reached 1% of net patient revenue. That's the first time in our history that we've done that. More work to do there, but a real nice progress there. And then real improvement in our discharge, not final billed performance. And again, communication with our providers to get their documentation done, real focus on giving them data so they understand where they sit in terms of getting their documentation. And then making sure they understand what we're holding, millions and millions of dollars of bills not going out the door because we don't have the proper documentation to send it on its way. So real improvement there. And then last, our labor focus. And again, for everyone, this has been a challenge, swinging this pendulum from bringing in all this agency and being understaffed to the bottom falling out in terms of volume and having to adjust very rapidly to this. And, I thank the leadership in Western Iowa. They've done an amazing job in flexing, reducing our agency. We're 8% lower in our FTEs this year. We're closing the gap on turnover, recruitment. We had 64 nurse vacancies when we started this year. We're at 28 as of yesterday. So a lot of focus on labor management as well. So it's not always about growth. I wish it were always about growth, but when it isn't, there are other opportunities to improve financial performance. So real proud of Western Iowa. Thanks, Mike.
All right, thanks, Beth. So you mentioned growth. Growth is the fifth key result to cover, and Raj Slater is going to cover that one today.
Hey, good morning, everyone. So it's been a tough year for ambulatory growth given the drop in volume due to COVID. I think most places across Iowa and across the country are seeing reductions in our clinic visits in the 15 to 20% range, and in our emergency room in the 20% range. So I thought when we started this year, we were going to have a slam dunk on this indicator because we added about 72,000 visits when we entered into our PSA with the Mason City Clinic here, our large multi-specialty clinic. So as Beth was mentioned, we were growing in this regard, and we also opened up a clinic in Albert Lee. So I thought we'd hit this indicator pretty easily, but you can see on the dashboard here, we're a little bit below our year-to-date target due to the other declines that are occurring. So we're working on recruitment. We just recruited a new rheumatologist to try to offset some of our demand. We're working with MercyOne Des Moines on our neurology gap. We also have pent-up demand in neurology clinic. In addition to that, we've been, I think, like other places, as part of the MercyOne growth plan, we're calling about wellness and chronic care visits, trying to get those scheduled. We've been looking at our template for providers to make sure that they're working what their assigned FTE is in the clinic every day, and opening up an additional slots for that. And we're also continuing to work on our online scheduling and registration process. And I know many of the other markets are doing the same. So that's in a nutshell.
All right, thanks, Rod. So Bob, I'm sure you'll agree that this has been the best update ever, rather than just listening to me cover the scorecard. We all get this scorecard. Typically, we have 300 to 400 leaders on this call. So I just want to throw out an invitation, because we'd like to try this format with one of our leaders providing an update on each of the key results, going forward, spending 1 to 2 minutes just either talking about what you do individually, what your department does, your entity, your market, or your region. So I'd like to throw out that invitation. If you feel passionate, or you would like to talk about one of those key results, cover it for this meeting next month, please let Cassie know. If we don't get volunteers, Cassie and I'll figure out how to ask someone to do that. So thank you thank you everybody for that update. I think it was great.
Great update, Mike. That was a very good update you provided, and certainly love to hear from our ministry leaders what specifically is going on to continue to improve. So hats off to all of you. Mary, I'm going to turn over to you. You have the last two items, the strategic plan and the advocacy update.
Okay, great. Thanks, Bob. Very quickly, touching on the strategic plan. First and foremost, thank you for many of you who participated a couple weeks ago in our strategic plan virtual roadshow. Of course, we wanted to be visiting the markets in person, and we will hopefully very soon. But we were able to share our strategic plan. I guess the silver lining would be that it's a lot easier for those who can't travel to be able to get on Zoom without driving 4 hours for a 1 hour meeting. So we were able to reach over 600 leaders from across the state to share our MercyOne strategic plan. And during that, we touched on just a few key tangible initiatives that are underway or will be getting underway. So as you see here, our 4 strategic pillars, and then underneath these, we have supporting strategies and initiatives that, like I said, they're all kind of at different phases, and there will be a lot more to come from a communication standpoint in the progress. The town hall is just one of those channels in which we look forward to being able to update all of you. And then you also hear from your leaders as our messages cascade across the state to our 20,000 colleagues. What I would want to emphasize, though, to consider, and I think just to for your expectations, is there are really 5 priority initiatives. Of course, everything's important, but we know we've heard from you to continue to focus. We want to try to eliminate competing priorities and understand where do we want to allocate our resources, not only from a personnel standpoint, but financially. And where we are focused now, especially in the next year and moving into the future, is urgent care, which was moving forward, and then unfortunately with COVID was paused, but is getting back up and moving. Digital health, which luckily we're farther ahead because of COVID, and so a lot of exciting movement there. Developing a unified medical group. Rob Heen's leading this effort and working with our colleagues across the state as we continue to determine the structure for MercyOne. The membership model, this was shared during the rollout in terms of really something that is very innovative and transformational for MercyOne in terms of how we can create stickiness with the consumer and be with them, not just when they're sick and wait for them in the ER, but be with them when they're well and ensure that we create that relationship. And then finally, the transfer system, which I'm going to touch on here next. But what I want you to know, because we did touch on it, it's something I want you to know we're working on and committed to it. We're moving as fast as we can, but thanks to Linda Goodwin, and I know some other PECS folks have been involved, but we're working through how we further, not only with these 5, there are a lot of other initiatives that came out of Project Forward due to the incredible work of our colleagues. We're working on how to ensure those are resourced appropriately and then even further prioritized, because we know we can't move the system office can't move these alone. It takes colleagues from across the state to help build these out and implement. And that's where the execution here is key. And we know that previously we can do a better job. And so we're trying to be very thoughtful as we've committed to you all to ensure that we're mindful of our colleagues who we're tapping into for these work groups and subgroups, recognizing there's a lot of moving parts. And you're going to hear a little bit about that with the transfer system. So I'm going to pause there and see if there are any comments, questions. Bob, I don't know if you have anything to add.
Questions from anyone? Okay, Mary.
Okay, excellent. So moving on to the transfer system. I am going to try to be fast and furious. This is really exciting to give you an update on the MercyOne transfer system. It's been a long time coming in terms of the work. Sorry, Cassie, if you can go to the next slide. Next slide. Perfect. So I just want to level set here, because even though I know for probably many of you, there's maybe been a bit of a pause in terms of information and communication around this, but many of our team members have been advancing our work around the transfer system. And for that, I thank you, and I'll get to some of those individuals. But A few years ago, as many of you know, network integrity was identified as one of our top priorities. And so we've been focused on that. But within that conversation, our colleagues had sat down, had some separate discussions to determine, well, where's the greatest opportunity? And really the hospital transfer work is where we decided to start, because network integrity, it can be really easy to boil the ocean. And so we wanted to focus just on the acute side, recognizing we know a lot of patients who are already within our hospital walls are leaving. And we wanted to really try to understand what the opportunity was. So of course, we have set out to create the fastest, easiest, most reliable system, a tool essentially for our providers to move patients throughout MercyOne and really seamlessly move throughout our continuum of care. And so what I'm really pleased and proud of is that throughout COVID, we have committed to daily huddles in terms of really gathering data to understand the business case and the opportunity around this. And I just want to celebrate that since last January, there have been over 425 huddles that didn't stop during COVID that happen every day at noon. And I just want to call out these people because of their commitment. Amanda Blanchard, Diane Murphy, Shauna Gunn, Riley Miller, Courtney Smith, Alicia Garrigus, Amy O'Malley, Barbara Marburger, Tara Smith, Lynette Howard, Carrie Miller-Dickow, and Jewel Sheely. Those are representatives from every market that every day get on to talk about, to learn from one another and really understand what can remain in the system that's being transferred out. And even within that, we've already recognized frankly, the return on investment by keeping patients within the system. So I really want to just say thank you to all of those individuals for their commitment. They're making a difference. And we have learned a lot because that allowed us to go to the MercyOne board last fall to get their support to advance one centralized MercyOne transfer system. So that brings us to where we are today. You can go to the next one, Cassie. So we had a steering committee that over the past year had helped bring the recommendation forth of moving towards a centralized system. So many of these individuals carried over and are the same, but we've added some others. I think what's important to recognize on this, and something that we were very intent on doing, is not only statewide representation, but it has to be physician-led, owned, and built. I know Dr. Seiko's on, a thank you. We have, as you can see, others from the system office and many leaders who have been very committed to this. And I feel like a car salesman in saying this motto over and over, but we are going to create the best system in the country. But it's clear, it needs to be understood that if it doesn't work for physicians, it doesn't work. And so we are going to ensure that physicians stay committed and engaged on this to be able to ensure that we create the right model that can be operationalized and work for physicians and in turn overall benefit our patients. So I'm going to say thank you to Dr. Modernock and Dr. Carrion for their leadership as co-chairs. And I'm going to let Dr. Modernock jump in here and share a little bit of his insight around the why behind this initiative. Dr. Modernock?
Yeah, so thanks, Mary. So obviously the greatest goal here is network integrity. And like anybody involved in healthcare, the physicians are looking for where can they receive the best care for their patients? How do they care for their patients? And then also, how can they efficiently work through their day? And really, MercyOne is a complex system, as healthcare is a complex system. And so the goal behind the call center is to assure that everyone within our system, all the providers, understand the scope of practice that can be performed within our system and where, and then how can we efficiently get their patient there. And the physicians involved thus far trying to develop the call center have been enormously engaged. And an example last night is as we were initially developing a protocol for acceptance for an exercise. And I think the best quote out of it was Dr. Mahoney, the orthopedic surgeon, who said, "Gee, I thought simply accepting appendicitis was easy. You guys have demonstrated for me the complexity behind it." And so great insight for that. So I'm enormously appreciative of the engagement of all of the providers across our network as we continue to build the best call center in the country that will keep our patients within our network receiving the best care possible. Thanks, Mary.
Excellent. Thanks, Dr. Modernock. So Cassie, you can go to the next slide, please. So this is a brief overview just so you can see that we're providing regular updates to the operations management team. That's part of our new structure, which is called the OMT. But the Transfer System Advisory Council is really going to be essentially making these recommendations and essentially then working with Bob in terms of any decisions that we may need their guidance or that may need to go to the members. So as you can see, the transfer system has a really important role. And then underneath that, the core project team, which includes representatives from across the state who are meeting weekly. And of course, with this, the transfer system is meeting monthly. And again, we're trying to, as the work streams get going, we'll bring up those issues so this group can help guide us. Moving on to the next one, Cassie, please. So now I'm going to cover some of the implementation work groups and purpose. So this is really key because, of course, this you can see a lot here, but these are all of the, let's say, critical tasks that are underway or will be getting underway in order to build the transfer system. So acceptance protocols and clinical services inventory with the stars next to them. We're going to go a little bit deeper, and I'm going to have Diane Murphy and Dr. Carrion share some insight and some background on the why with those. But I just want to touch on the others so you know that other than the dot point, really what these mean. So in terms of the future operations and workflows and scope of services, this is going to be really important, and we haven't begun it yet because part of this is to understand, we have the current state and future state and what does long-term look like. And part of this with the scope will be right now, the focus is on transfers, but down the road and as other systems have successfully done, do we incorporate virtual care? Is that on day one? EMS dispatch, air transport. Long-term, that is the vision that you'd essentially have a mission control that would be able to really oversee patient logistics across the state that again, can really handle the seamless movement of our patients throughout our system of care. And then really supplementing that or underneath it is the operation and workflows to ensure then we have the right processes in place along with those protocols to be able to support the functionality. Communications, our focus right now has really been on North Iowa and Central Iowa because just as a reminder for the group, those are the two markets who have physical transfer centers. So we really are spending a lot of time in trying to understand the current processes and functionality of each of those, knowing that is where the transition will need to occur at the greatest level, but because recognizing the others may have referral management processes and of course how supervisors and others connected to it, but we will be continuing to work with them and communicate to the key stakeholders, leaders, but specifically physician groups, recognizing that, for example, an acceptance protocol like appendicitis, recognizing we need to bring in those who are going to have to help operationalize that. Moving down to technology, this is a really important one because in the business case, teletracking, which exists in some markets, that will allow bed visibility across the state. We are working currently with our members to understand how, not only how, but when we would be able to implement. This is why the timeline for this is very fluid. We are working towards this fall, but we also know that we have to be nimble and recognize what can move and any questions we don't have answers to. We're going to have to, be somewhat nimble in terms of trying to work through that with the members and IT and understanding though what can advance regardless, knowing that some things won't be dependent on IT and that network integrity, which a large part will be part of our culture, our behavior, some of our operations and changing that across the board. And then finally, I'm going to skip down to the dashboards, analytics, and service line strategy. Dashboards and analytics, this is critical because this is going to determine how are we going to measure our success? How are we going to hold ourselves accountable? Because we have to be able to know, are we moving the needle? Are we keeping more patients within our network when and where clinically appropriate? But moreover, does this work for physicians? Is this improving physician experience engagement? Is this improving patient experience? Are we working more closely with our rural affiliates to support back transfers? Those are just a few examples. We have to have those metrics in place and monitor those rigorously as we move forward. Finally, service line strategy. Linda Goodwin's working on this and our focus is on cardiac. But why I'm calling this out is relationship building with the docs has been critical. And though Dr. Modernocht and Dr. Carrion don't know this yet, I'll go ahead and let you in on the secret. It's going to be like a Thelma and Louise roadshow, but it's going to be Paul and Hino. And we're going to get them a convertible. And this summer, they're going to be going out across the state, hospitalists to hospitalists, ER docs to ER docs, ortho to ortho, because we know it's really critical that we have to build up those relationships, build that trust, learn from one another, because we're all very unique. So I'm going to stop there. You can go to the next one.
Hey, Mary, I just have a question. When they do this roadshow, will they do karaoke?
Yeah, we're currently doing an inventory of karaoke bars across the state in our MercyOne market.
No, I mean, while they drive their convertible up the country highway, I think they should be doing, what's it called? Karaoke in the car? Yeah, it'll be good.
Bob,
Yeah, I can tell Paul's excitement.
Bob, if I sing, my kids turn the radio way up. I'm tone deaf.
Carpool karaoke. Thank you, Courtney. You're absolutely right. And
Yeah.
Ryan. That's
Okay,
it.
now we're going to have a GoPro video camera on the front of the convertible. Please chat me directly if you have any ideas, just directly, not to everyone.
I'll give them my Zoom camera for their car.
I'm going to turn it over to Diane Murphy to do a quick update on clinical services inventory, because I know many of you on the phone have been clamoring for this, and it's going to happen. So Diane will give an update on this, and Dr. Carrion will share quick background on acceptance protocols. So Diane?
Yeah, thank you, Mary. So clinical services inventory is one of the work groups that Mary had just identified as a key step in developing a transfer system. We've now lovingly renamed it to the MercyOne Encyclopedia. And truly how this started is in the last year through our daily huddles that Amanda Blanchard from North Iowa has really been owning and leading for us. There's a huge gap in understanding across the state on what capabilities we have, what specialties we provide, what specific procedures we can do where and when. So there's, caveats in each market on what providers can do and when they can do it based on call schedules and availability and things like that. And so this seems simple because it's information that we utilize in each of our markets on a daily basis. But it's really a very large project, because a lot of times the information from each of our facilities is it's in people's heads. It's not documented anywhere that's easily shareable. So Amanda is leading this group, and we've started with some of those individuals who are on our daily huddles who really know this information in and out, because they deal with it every day. And we're starting slow. Just let's get everything down on paper in a document so that we can start to sift through it and find out and understand where we need additional details. In addition, we are utilizing our acceptance protocol provider group to also engage and help us understand the services that, from the provider perspective, that they offer in each market. So this is a huge amount of work, and but it's much needed, and we've identified that again over the last year. So these are the three kind of buckets, main buckets that we're looking at to start with. The clinical services is just what do you provide? Are there specialty procedures, specialty services? Can they accept patients as an admitter, or are they just consulting? When are they available? And any obvious exclusions. In addition, the nursing capabilities, so just understanding a little bit more about each of our acute facilities and if they have specialty skills, specialty units that can be utilized, and a little bit about how patients can flow into their facility. And then finally, equipment, which just goes along with how can we take care of patients in each of those facilities, if there's any specialties or special types of beds or accommodations at each of the acute facilities. So it's a lot of information, but we're starting to work through that, again, with both providers and our huddle group to get that on paper so that we can take it back to the markets and really validate that with a larger operational group.
Thanks, Diane. And I would be remiss if I didn't say congrats to Diane Murphy, who started this week as the Director of Patient Logistics. So she is working on leading this effort and will be overseeing the transfer system. Next slide, Cassie. We're going to, last but not least, Dr. Carrion's going to share a little bit about acceptance protocols, which arguably is the heaviest lift. But to me, it's been the most exciting, and hearing our physicians have very robust discussions around what this should look like. So Dr. Carrion?
Thanks, Mary. I also can't believe we're at that point where we're actually discussing acceptance protocols. To emphasize what you had alluded to earlier, the lift that has occurred between the inception of this kind of what was a thought to where we are today. I cannot extend my gratitude enough for everyone that has been involved in that process, because it has been significant to get to this point. But to, again, emphasize, how do we build that quick, easy, and reliable process truly is dependent on these acceptance protocols. And we believe these will be instrumental to the success of this transfer process. Now, what Paul didn't allude to earlier was he actually implemented this great tactic last evening, and he pretended to be the MercyOne operator and said, okay, I have an appendicitis patient. And the conversation and engagement from the providers was just astounding. I mean, we ended up with a 500-pound end-stage renal failure post-operative patient by the end, but regardless, we got them to the location that they needed to be. And again, after we debriefed a little bit, messaging back and forth, I thought it was an excellent tactic. And again, just demonstrated the difficulty and challenges of something that we would think is simple. And again, that case being just hopefully an aberrancy and not a situation that would become true. We realize this is possible. And I think everyone that left that conversation felt extremely encouraged by the dialogue that occurred. So again, kudos to my co-chair. I think he did an excellent job facilitating the conversation last evening, and the engagement was just palpable.
Thanks, Dr. Carrion. So a lot going on, tried to fit a lot in, and I apologize, Cassie, I'm sure I'm over time, but would just say, you can chat me questions. I know we'll be handling those, but also if you have any questions, we're going to be sharing talking points more widely with the market presidents and advisory council, and would just ask, if you need a presentation or you have a group of stakeholders, we want to ensure there's broad awareness. And also just appreciate that the COVID learnings I think we're trying to carry with us is that throughout this, we have a lot of unknowns. We're trying to remain nimble and be comfortable with ambiguity, but also focus on progress, not perfection. So appreciate everybody's engagement and support of this important initiative.
Thanks, everyone. Great update, and certainly a strong sign of one. Mary, do you have an advocacy update or?
I do, and the challenge to me is I have to do it in a minute. So Cassie, you want to share these slides, or do we not even want to go there?
Don't even use slides, just do your minute update.
Okay. Well, wow, this is a challenge, because if anybody reads or watches the news, I can't even keep up. So side, I will tell you, we are all over 340B. It's a big issue. It's a problem. It needs to be fixed because it's $20 million to MercyOne. Rural healthcare, there was $8.5 billion in the latest package, along with $500 million in grants. Sorry, the T's, the B's, the M's, the Z's, they're getting mixed up. So I hope I have those numbers right, but we're trying to understand how we can utilize those dollars for Iowa or MercyOne and working with the state. Additionally, Medicare sequestration, this is the latest thing, and it's probably happening literally right now in DC. We want this to be delayed. This is $11 million to us, a 2% cut. And then next year, there would be more cuts. So we're working closely with Grassley and Ernst because it's moved over to the Senate, and they're critical in this. We believe we have their support along with a rural health clinic fix. Thanks to Matt Johnson, who supported that with a quote to Grassley. So again, that's on the federal side. We're working on that. On the state side, a lot going on. Our lobbyists are working hard. I would just say that we have a good projection for the March revenue estimating projection. So the state is in good shape with projecting an $8 billion budget, but that we also know that amidst that, we're trying to move forward and make improvements to our working relationship with MCOs, days waiting placements, the look back, things to improve workforce and our accessibility to that, and childcare, mental health. The governor has a lot of money in, but we also know there's more money coming from the federal side. Finally, EMS, we want it to be an essential service, waiting for the Senate. And finally, still monitoring visitation rights, which we know is an important issue. So I'll pause there. Cassie, kick it back to you.
By the way, I love the 1-minute updates. That's going to be our new model. Our meetings will be 16 minutes in total. Cassie, any questions from our chat?
I don't have anything, but
Does
please
anybody have any
drop them in.
questions? Anything else you want to add? Jason Monarch, did AMC stock go up the way you were hoping it did? No? I can't hear you.
My bad, no.
I was visiting North Iowa last week after leaving Sioux City, and Jason said, I'm out, and if the AMC stock, he had a note on his door, if it goes up to a certain level, he won't be back. So I'm glad to see you're back. Sorry for the reason, though. I am making rounds again, much to your chagrin, perhaps, but it's been awesome. I think next week is Waterloo and Dubuque and Clinton, I believe, and I think Iowa City thereafter. I've had great stays in Sioux City and North Iowa, and yesterday all day here in Central Iowa. And let me just say, I can't wait until these leadership meetings are in person. We at least need a couple a year because it's just not the same. But you guys are doing great work, and we really, really appreciate everything you're doing. Becoming one is not easy. And when you look at systems like ours across the country, those that succeed and those that don't, the difference is the commitment of the leadership team to have a shared vision and a willingness to see it come true. If it were easy, anyone could do it. If it's hard, it means it's probably worthwhile. So let me just say that we are incredibly grateful for your commitment, for your tenacity, and mostly for the inspiration you convey to all those 20,000 people we call MercyOne through your leadership and through your presence. And with that, I'm going to say thank you. Have a great weekend. And if we don't talk again before, happy Easter. Thanks a lot.